now. And when I get done, what I'll do is I'll post that recording up on YouTube and send you the link.
Oh, great.
For anybody who's not going to attend. I'll tell you what, why don't we go ahead and get started? If anybody else comes in, they won't be missing much of the kind of the intro and the overview here. Pardon me. Well, thanks again for joining us. As you can see, my name is Fred, and what we're going to do today is we're going to go through kind of a big picture of what is the VMSG dashboard. Now, first thing I'll tell you is that this presentation has been nicknamed A Drink from a Fire Hose. Recently, we cut it down a bit to just a drink from a garden hose. So what we're going to be trying to get you to understand is what is the big picture of the VMSG dashboard. You really don't have to take any notes. If you go look at the meeting invitation, there's several attachments to it. One of them is a copy of the slides that we'll be using today with notes page underneath that. One of them is your login procedure. So how do you get in? We're going to go through that live in the system. So you really don't need to take any notes. So just kind of sit back and absorb what we're going to be doing. When we get into the next training, which is the operational planning, we're going to get into a whole lot more detail. And then we're going to go from there into performance management and three-dimensional planning. So those are future trainings. But today is just to give you the understanding of what the VMSG dashboard is about here. We've had a lot of health departments coming back from COVID, especially. We've had a lot of turnover, and a lot of them kind of seem like what we call the chaos horse here. They're just kind of trying to get things back again, get new people trained up on how to do things here. One of the things we hope you'll be able to see after today is the VMSG dashboard is a tool to allow you to organize things. And it's going to help you to go through the accreditation process when you guys decide to go that route. Getting any kind of a plan in place and be able to monitor the health of the plan as you're moving forward. So we're kind of hoping you'll end up kind of in the chill mode after you think about implementing the dashboard here. So what is the VMSG dashboard? First of all, we are specific to public health. We've been working in public health about 22 years now. And we developed a system with several public health agencies here in Arizona, specifically for the needs of public health. And this was, by the way, before FAB even came about. What the system is, if you kind of try to define it in one sentence here, is a comprehensive operational planning and execution system. One of the things they wanted to have here is the ability to keep those plans up to date and keep them alive. So we integrated the PDCA, our nomenclature is plan, do, check, and adjust. Some people call it the Deming cycle. And I know there's a lot of different versions of PDCA in there. Plan, do, check, and adjust. And we'll get deep into that in a few minutes here. But what it allows you to do is plan and execute anything and then keep that portion of the plan up to date and understand exactly where you are in the plan. Back in about 2011, when FAB came along, it turns out that these health departments had a fully demonstrated performance management system for standard 9.1 and measure 9.1.1a, which talks about implementing a performance management system here. One of the primary reasons that the VMSG dashboard works so well in accreditation is when you look at things like FAB measure 9.1.6. It says provide 2 examples of staff at all levels, including leadership and management, engaged in developing or implementing the health department's performance management system. We have a tool which we'll get into detail on here in a few minutes called real-time planning. And it's an automated email that goes out to pretty much everybody in the department. They have the chance to then go back in and update portions of the plan that they're responsible for. So what that does is engage everybody, in fact, directly in performance management. So it kind of automates 9.1.6 for you here. Now, what is performance management? If you go look it up, you're going to see lots and lots of definitions, a lot of them related to HR, and that's not where we are. What we're looking at are 3 different phases here. Number 1 is operational planning, developing operational plans using the integrated planning model, the pyramid that you see, and we're going to go into more detail in a minute as well. The plans that you see in the bubbles out here are what FAB calls their 6-pack of plans, or some people call them the big 6 plans. The minimum plans required for accreditation. Some of them get combined together, like your workforce development, your QI plan often get combined into your strategic plan. But in a nutshell, you have to end up having these 6 plans to start with for accreditation. And once you get your, and by the way, this is just a sampling of what you can put in there. You can put plans for anything in the system. So you can have a QI plan, you can have a community health improvement plan or community health development plan, community health division plan. You can have plans for pretty much anything in the department in there. Now, once you get the plans in place and you're executing the plans, we need to be able to monitor the plans, and we need to be able to monitor them at multiple levels. The first level we'll talk about today is the macro level, or the high level plan. So that's at the pyramid. It's at the kind of the very top. I'm looking at the entire department maybe, or I'm looking at my entire strategic plan on one screen here, or I'm looking at community health division on one screen. It's kind of the example we use today. Now, when you're looking at that big a picture, sometimes you don't see the little stuff that's creeping up on you at the bottom. That's what we call the micro level. The micro level is down at the bottom of the pyramid. You can see up there the objective and activity level. So if one of those starts going awry, it's eventually going to affect the big picture. So we try to keep track of it at that lower level as well, so it doesn't get out of hand before we get to the macro level. And then we're going to talk about VMSG Public a little bit. When we go into the next the future training called performance monitoring, we're going to go into great detail on VMSG Public. But VMSG Public is just a way to take any of the data elements in the system and create a public-facing web page. And it's a very graphically oriented web page, pie charts and schedule gauges and that sort of thing on there. And again, we'll talk more about that later. The final step kind of is that performance improvement cycle, PDCA cycle. So you built the plan, you're executing the plan. While you're executing the plan, you're collecting information from everybody responsible for the plan elements through the real-time planning. You're going to use that information to check the plan against the actual, and then you're going to be able to make adjustments if necessary and go back through the cycle. Again, I'm going to walk you through this in detail here in a few minutes. So let's talk about the operational planning model. This model's been around for at least as long as I've been in public health, like I say, 20 plus years. It's a very, very concise model on creating operational plans in a very structured hierarchical format. So the very top we call the pyramid here is the organization, which is merely your health department. Underneath that, the groups. Groups are a little bit nebulous. They can be lots of different things. Like number one, they are the structure of your health department. So the divisions, the offices, the programs, and how they report to one another. Groups are hierarchical. They go down to 10 levels deep, so you can have lots and lots of structure in there. Typically, these plans that you see up here in the bubbles are also individual groups within themselves. So the strategic plan is at a high enough level that it encompasses an entire group. Underneath the group, then, you have what we call services or initiatives. So each group is comprised of a set of services. What does this group provide to the organization or to the community? Or initiatives, which are what does this group want to provide in the future? Each service or initiative then has a set of high-level goals. Each high-level goal has a set of SMART objectives, and we'll get into more detail on that in a minute here. Each objective then has a set of action steps or activities. How are we going to get to the objective? So what we're going to do now is we're going to go live into the system. We're going to walk through the process of developing an operational plan, take that plan through its life cycle, so you can see the performance monitoring tools, and then take it through the PDCA cycle to see how we might make improvements in the plan. So we have a little demo organization we call USA Public Health, and I will tab over there now. So when you log in, and again, I'm going to walk you through the login process later. When you log into the system, you're going to see a screen similar to this, depending on your permissions as to how many of these buttons you'll see down here. But these tabs across the top is that pyramid I just showed you flipped on its left side. So as I'm navigating left to right on the tabs, I'm going down the pyramid. So my organization, my health department, my groups, my service initiatives, my goals, my objectives, my activities. So I'm going to select my groups tab. So now I've gone down one level on the pyramid. You'll notice I'm sitting at community health division. Everybody who's a user in the system has a default group. So when you log in, you're going to go to your default group or your area of responsibility. What that does is just save you navigating around if you're looking for the dashboard for community health or a specific plan for community health. It's going to be right there. Under community health, you can see we have this group called tobacco. Now the levels over here indicate the hierarchy. So the department is typically always level 1. That's the top of the groups here. Underneath that, you'll see these FAB 6-pack of plans down here as level 2s reporting to the department. And then we'll get down here to a group called administrative services. You'll see the level 3 groups underneath that, finance, HR, and IT. So again, it's just the hierarchy of the organization. So under community health, we have tobacco and WIC. And again, this is just our little demo organization. So I'm going to select the Tobacco 2024 group. Now I'm going to go look at the services or initiatives for Tobacco 2024. You see we have three of them: tobacco cessation, secondhand smoke, tobacco initiation prevention. I call these buckets. These are buckets of plans that we're going to be implementing in here. So all the plans in this group or in this initiative are going to be around tobacco cessation. Underneath tobacco cessation, we're going to have a set of high-level goals. So here's a couple examples: reduce smoking in high schools, reduce smoking in colleges, reduce smoking in public areas. Now, when I say a high-level goal, if I tell you we're going to reduce smoking in high schools, that makes sense to everybody what we're doing. What it doesn't tell you at this point is which high schools. It doesn't tell you by how much. It doesn't tell you when we're planning on doing it. So again, I call it a high-level goal. When we get down to the goal level, we start setting a traffic light out there. Traffic lights are a visual indication of status. We have 4 different traffic lights. Green is exactly as you expect it to go. Everything's moving along as expected. Ideally, you want to keep people, around the green level here if you can. Yellow would indicate something is slowing us down. Red would indicate something's brought us to a screeching halt. And then the gold bar indicates successful completion of this portion of the plan. So you can see we're sitting here at a yellow, and there's a note down here that says one of the high schools is not at the planned reduction. Okay, probably why we have the light set to yellow in here. Now, underneath the reduce smoking in high schools, we're going to have what we call SMART objectives. Our nomenclature for SMART is specific, measurable, attainable, realistic, and time-based. I know there's lots of different versions of that. That's the one that we typically use. So here's an example. We're going to reduce smoking at Wayne High School, which happens to be my alma mater from lovely Dayton, Ohio, by 25% by the end of the school year. So if you think about it, the reduce smoking at Wayne High School is very specific. Our measurement is by 25%, and our time frame is by the end of the school year. So it fits that SMART criteria pretty well. Pardon me. In order to get to that particular objective, we're going to assign this person called an objective lead. Steve Hansen is our objective lead. You can assign anybody in your user base in here as the objective lead. Steve's basically got 2 jobs. Number 1 is to get us to this 25% reduction. So he's the program manager or project manager. Number 2 is to update the status. In this case down here, you see it says at 22%. That's the current status that we're looking at in here. Now, in order to update this, Steve is going to use what we call real-time planning. So he's going to get an automated email from the system on a regular basis with a link that takes him right back into this particular objective to update the objective and any other objectives or activities he's been assigned to. So that's kind of Steve's responsibility here. Now, a couple other things you'll see over here. You notice the notes on the goals and the objectives here. We have notes field as well, and the activities. What this is a running dialogue about this particular planning element. You'll notice up here I have a date, time, and a person stamp up here. That's what this little button right here does. It adds that date and time stamp for you. So you can know who's doing when or who's doing what when, I guess, as you're adding the note in here. It says at 25% plan reduction here. The other thing we added over COVID, while we had a lot of extra time while you guys are out saving the world, was to be able to attach a data source to every plan element here. So the goals, objectives, and activities all have this data source. You can see our data source is the CDC Smoking Cessation Fast Facts webpage. So what we're assuming by this is that's where we can go to get the information we need to update the status of this objective. To get there, you just click on this little link right here, opens up a new browser window, and takes you right to that particular CDC webpage in there. So what we're saying is we're going to be able to get the data we need to update this particular objective. So why not have it at our fingertips here? And again, you can have data sources at the goal level, the objective level, and the activity level. So this is our SMART objective here. And you can see we got 2 of them: reduce smoking at Desert Vista High School by 25% as well. Underneath the objective, we're going to have a set of actions, action steps or activities. And this is what are we going to do to get to this objective? Let's go look at those. So now our first activity here is we're going to create training content and materials for students and faculty on the dangers of smoking. There's 3 types of activities in the system. And again, the next training we go into, the operational planning, will go into great detail. For today, we'll talk a little bit about the differences and why use them here. Project-based activities by far the most common. Probably 85–90% of what you'll put in the system are project-based activities. Think of that exactly as that. This is a project to create the training material. So creating PowerPoints, maybe some video modules, maybe some user guides, that sort of thing. Every activity's got a performance metric. It's simply, how do I know when I've successfully completed the activity? So if we're creating training materials, once we've created the training materials, we're done with the activity. Pretty simple. We got a beginning and ending date. So this is when we planned on creating the training content. Now, over time, these dates can shift based on what's going on in the real world here. Our measurement in this case is percent complete on a project-based activity. So you notice down here in the notes, it says Diane Cox put in, we completed chapter 1, and you can see overall there was 4 chapters. So this is probably at a 25%. When she completed chapter 2, maybe 50%, chapter 3, 75, chapter 4, 100%. So that's our measurement. It's a very simple measurement. Now, the other thing we're going to do at the activity level is we're going to assign teams of people. So by clicking on this little pencil icon and then clicking the X up here to open it up to the whole department, you can see I have these 3 checkmark columns. Number 1 is team members. So we got 3 people. We got Diane, we got William, and we got Andrea, who are the team members who are creating the training content. Diane Cox is our lead. So she's guiding the team to get the training content created. And then here's that email notification. That's that real-time planning again. So in addition to Steve getting an email to update his objective, Diane's going to get an email to go back in and update this particular activity, or how far along is the team in creating the training content. Over here on the right, FTE, full-time equivalent, not used a lot. And the reason for that is it's something that you're going to use when you need to determine budget dollars or grant dollars or something like that. So an FTE, full-time equivalent, is a 0 to 1 factor in here. So it's 0 to 100% of your time. So you can see up here, Diane has indicated it's about 10% of her time to complete this activity. William about 10%, and Andrea about 30%. So we can add these numbers together. When I go back and look at the activity, you'll see down here we have the FTE summed up to a 0.5. If I take all 3 of these activities and roll them up to the objective, you can see we have a 1.0 FTE down here. So I can roll that up all the way up the pyramid. Excuse me. What that allows you to do is to be able to calculate using that, how much is this program costing us? So as you're building a budget for next year or looking for grant dollars, you got some real numbers to work with in there. The other thing we have down here is the ability to add external partners. So you can see we've added VMSG Dashboard, and specifically Fred Erickson as VMSG Dashboard as an external partner. So these are the folks you're working with typically in your chip or something like that, who are working with you to, in this case, do the training content here. Now, if you choose to, you can make Fred a system user, which then allows you to make Fred the email recipient. So if you got an activity that's just being done by an external partner, they can be the email recipient. They can do the updates automatically without having you to, without you having to play phone tag, etc. So that is activity 1, our project-based activity. Now, activity 2 is we're going to take that training content we just created, right? We're going to provide 9 training sessions each month on the dangers of smoking to students and faculty. We call this a QA or quality assurance activity. The QA activity is the least used type because it's very unique. It's cyclical. So we're going to pick a frequency. In this case, the frequency can be anywhere between weekly and every 5 years. We're saying we're going to do this every month. So we're always measuring within a monthly cycle here. So instead of having a beginning and ending date, we just got a start date for the cycle. In this case, 4/15/24 is the start date, meaning the ending date would be, 5/14 of 24, something along that line. And that's going to move forward every month, so you're always measuring within that monthly cycle. The other thing this particular activity does is automatically set that traffic light for you. So we're providing values. We know that we're trying to target 9 training sessions a month. So if we get to 9, it's going to be green. And we picked a number of 6, and if we only do 6, that's not good enough. We're going to call that red. And if we do 7 or 8, we're going to call that yellow. So cyclical automatically sets the traffic light. And again, you're going to assign teams of people and potentially external partners over here. Your measurement is entered over here. So in this case, I entered 7 training sessions, and hence the reason that the traffic light is yellow in there. Our third activity then, in addition to doing the training, we're going to contact all 20 tobacco vendors within a mile of Wayne High School to ensure they're not selling to minors. We call this a quantitative measurement activity. It's the second most used type, by the way. Very similar to the project-based activity with kind of one exception, and that is that we have a target number. So by having a target number, it makes it easy to calculate the percent complete. We can say, if we contacted all 20 out of 20 tobacco vendors, we're 100% complete. If we did 10 out of 20, it's going to calculate down here to be 50% complete. Other than that, it's pretty much identical to the project-based activity, team members and external partners as well. So this is the operational plan for tobacco cessation. Now, if we go back into our pyramid, it looks like this. The group we were working in is Tobacco 2024. Of all of the initiatives, we selected tobacco cessation. Under tobacco cessation, we had 3 goals. We selected reduce smoking in high schools. Under reduce smoking in high school, we picked reduce smoking at Wayne High School by 25% by the end of the school year, and then the activities we're going to do to get there. So this is the planning process. Like I say, we're going to go into great detail on this, and we're going to go through real live examples of public health groups and initiatives and goals and objectives and activities, so you get a good feel for it as you're developing plans in the system here. So now we have our plan in place. We know that's okay. Let's walk it through the PDCA cycle. So there's the plan. It's done. Next thing we're going to do, obviously, is execute the plan. So that's what the do phase does for us. And this is where we collect the real-time planning. This is where we collect the current status of everything. So Steve is going to get that email that asks him to update the current status of our reduction in smoking at Wayne High School. And then Diane's going to get an email that says, hey, how far along are you in creating the training content? William's going to get an email that says, how many training sessions did you provide this month? Tom is going to get an email that says, how many tobacco vendors did you contact? So we're collecting all that information in the background. Now, the reason that that's critical is because without that information, you can't do the check phase. You got to have an actual. So the check phase is simple. It's comparing the plan to the actual. Well, the actual is what we're collecting. The plan in this case was a 25% reduction. Now, if we go back and look at that, I'm going to look at my objective level here. So we got a plan of doing a 25% reduction. Where are we? Here's the little chart that's telling me over time, we started out at a 0% reduction in a brand new plan and slowly ramped up and got to our 25% reduction. So at this point in time, our plan is 25, our actual is 25, everything's working beautifully. Now, back to the PDC, that was the check phase. If you're collecting up that information in the background, it's that easy. If you're not, if you decide to manually collect that information, every time you do the check phase, you got to go collect that information in order to have something to check with. Let the system do the work for you. After the check phase, we're going to go into the adjust phase. The adjust phase says, do we need to make any corrections? Well, in this place, everything seemed to be working great, right? We can bypass the plan, continue the execution, check it every once in a while, continue through the cycle. So if everything is on track, you're good. Now, let's assume for a second that when we looked at that chart, that top right corner was only at 21%, not 25. Now we got to make a decision. The decision is the plan too high? Is it just really not possible to get to 25? If that's so, let's take our plan and adjust it down to 21%, continue through the cycle, try to keep it at 21. Maybe we say, no, the plan is okay. We can get there. We just need to have more resources. So in this case, we're going to say, hey, maybe if we do 12 training sessions a month versus 9, maybe there's more tobacco vendors out there we didn't know about. Maybe there's a whole nother set of activities we haven't thought about yet to get there. So we're going to adjust the resources to get to the plan. And then the fourth option is kind of in between. Maybe we take the plan down a little bit, say to 23%, and maybe by going to 12 training sessions a month versus 9, we can get to 23%. So those are kind of the options. Pardon me. The nice thing about the PDCA cycle is it keeps your plans up to date continuously. In the FAB world, when you decide to go through the accreditation process, each of these plans has a given life cycle in the FAB world. Your strategic plan is 5 years, your CHA and your CHIP are 5 years. If you're updating the plan, let's say once a month, which is a typical cycle here, this plan has a new start date basically every month. So in fact, the plan has an infinite life cycle because you're always keeping the plan up to date. So this is your PDCA cycle. Now, the chart that I showed you is what we call micro level performance monitoring. That again is down at the objective or activity level. Macro level performance monitoring is what we call the dashboard itself, kind of the namesake screen, if you will. Let's go back and look at that live. So I'm going to go back to my group screen. So dashboards are dependent on the selected group. If I want to have a dashboard for the whole department, I can go up here and select that. If I want to see a dashboard just for the strategic plan, I can select that. Again, I'm going to be the community health director today. So when I logged in, you remember it took me right to my area of responsibility or community health. So what I want to be able to see is a dashboard that gives me community health and the subgroups of community health, in this case, tobacco and WIC. So to get there, is all I got to do is go up and click on this traffic light in the top right corner. It's now going into the background and putting together, depending on how much data you have in there, literally hundreds or thousands of data points to bring it all together and summarize it into a screen that looks like this. So the first thing I like to show people is this home page button up here. There are 3 screens that have this button. This is one of them, which what that means is when I log in, where do I go? If I wanted to go directly to the dashboard for my area of responsibility, I can set the home page to be here. When I log in next time, it takes me directly to here for community health because, again, I'm the community health director. The other 2 screens are the main menu, which we saw when we started out, which is the default, or the reports menu. Now, if somebody, let's say you've got an administrative assistant who's generating a weekly report for the health director, why not just goes directly to the reports menu and click one button and you got the report done in there. So just kind of try to make things easier. Top left corner up here. This is the summary of the traffic lights at each level, my activities, my objectives, or my groups. So those are the 3 levels that have traffic lights. Over here, I'm looking at the number of red, yellow, green, and gold traffic lights. And you might notice the little click finger when I roll over, meaning I can drill down on anything on this screen, get to the data elements behind it without having to search for anything. So when I want to see these 3 objectives that are or activities that are yellow, I can click on it. It's going to show me the activities. I can adjust them if I need to get back on track, whatever I need to do. And again, we'll go into that in the performance monitoring training. The schedule gauge, it says 32 right here, says we are 32 days aggregately across these 10 activities. We're 32 days ahead of schedule. The way that's calculated is pretty simple. Beginning date, ending date, % complete. So let's say the beginning date is January 1st, the ending date is December 31st, today is July 1st. I'm exactly 50% of the way through the year. If that activity is only 40% complete, I'm 10% behind schedule. If that activity is 60% complete, I'm 10% ahead of schedule. So what it's doing is aggregating all of these activities. Some of them may be behind, some of them may be ahead. Aggregately, we're 32 days ahead of schedule. We get down to below schedule or on schedule or just below schedule, it turns yellow. Get down to 60 days below schedule, it turns red. So by looking at the colors here, it gives you a good snapshot of the performance. Now, down here, I can drill down even further. First thing I see is my people. So I got my activity leaders, those folks we assigned as the activity leaders, showing up down here. This first column says, when did this person last update their information? You'll notice it's color-coded. Green is less than 30 days ago. Yellow is 30 to 60 days ago, and red is over 60 days. Kind of in an ideal world, you want everybody to be in the green. So let's say, again, I'm the community health director. I'm having my monthly staff meeting with my folks. I throw this up on the big screen in my office, and I walk everybody through this, what I'm looking at here. So, I really like to work with as real-time data as I can. So ideally, I'd like to see everybody be green. Explain the color codes to them. I will guarantee you that the next meeting you have, every one of those will be green. There's an old adage that says, people listen to what you say, people do what you audit. There's kind of a built-in mini audit for them right there. So what you want to do is get everybody to keep that updated so you're always working with real-time data. As you recall, we had the FTE number at the bottom right of the activity screen. Well, what we're doing here is rolling those numbers up by person. So how loaded is each person? Lagging here says I have an activity that is calculated to be behind schedule, the same calculation we had up here. The days is the same as this schedule gauge for the individual person. So it says William is 52 days ahead of schedule and looks like Andrea is 15 days behind schedule. Overdue says I have at least one activity that the ending date of the activity is before today and it's not 100% complete. So in fact, it's overdue. And then the number of red, yellow, green, and gold for that person. So that's our primary view here. We have 2 other options here. Number 2 here is groups. So if I click on a group screen, this first column changes to Community Health Division, Tobacco and WIC. Remember the 3 groups on my responsibility, and the same data elements over here. And then my third view is priorities. That is the strategic priorities from your strategic plan, what we would call the services or initiatives from your strategic plan, show up down here. And then what we're doing over here is mapping everything else in the system, your CHIP and your EOP and everything else against the strategic plan. So it gives you an idea of Does everything, in fact, roll up to our strategic plan? And how are we executing on our strategic plan? So it really is a nice tool to be able to look at that. And again, we'll go into great detail on the screen when we get into the performance monitoring training. My priorities in the top right corner. These are basically a bookmark. So what I've done is selected these objectives that I want to keep my eye on. Typically, you're going to select things that are yellow and red because they kind of need help. And a lot of times you're going to select things that are either directly under your responsibility or your team member's responsibility. And you can just click on this. There's a little green flag on the objective screen. You can unclick it, it turns gray, and they disappear up here. So you can pick any objectives from anywhere on any plan and put them up here just kind of as a front and center to keep them exactly where you want them to be up here. So this is the dashboard. This is macro level performance monitoring. Now, one of the things we did over COVID again is we added what we call VMSG Mobile. What that is the ability to do a lot of these functions on your phone. The cool thing about it is you don't need an app. So you don't have to go to the App Store and download it and get permission if you need to from IT or whatever. You just go to your phone browser. You go to the same link that we'll be talking about later to log in, the same exact login credentials. It knows it's a phone. It'll bring up these three screens versus the one screen you saw. And these little arrows take you back and forth between the three screens up here. But again, everything on here is clickable. You can drill down to all the data. You can set the my priorities. But if you're not in the office all the time, you want to have the dashboard, it's right there on your phone. Now, are you guys heading for accreditation?
Yes.
Oh, you are? Okay, great. 2022, I take it, and you're just going through initial accreditation?
Bill will probably be able to explain it better, but we're going through all the motions.
Okay, awesome. Okay, so
yes, we're initiating the process.
Awesome. Well, this is going to be great then for you. We have all of the accreditation plans built into the system here. I'm going to go ahead and take you back into the group screen here. So when I scroll down here, we got the older 1.5 version, and as of July of last year, it's all 2022. So this would probably be the plan that you'd be looking at is the FAB 2022 local accreditation. So there's a state, local, and tribal, as you're aware. If I start drilling down the plan here, the first thing we see is the accreditation process. So there's a whole plan underneath that, the preparation, which I'm assuming you guys are doing now, application. You're going to end up doing document selection and submission. And by the way, there's going to be about 300 to 1,000 documents you're going to submit. You're going to go through your site review. They're going to make a decision, and then you go into your reaccreditation process. In addition, what we've done is we've linked this back to the FAB documentation. I'll show you that here in a minute. So the key elements here are your domains. Underneath your domains are your standards. Now this is where we go right back to the FAB documentation for the standards here. So we got FAB standards and measures, standard 1.1. If I click on this link, it's going to take me right to the FAB documentation for standard 1.1. So what that allows you to do, in addition to, and by the way, we have most of this stuff built into the plan, but if you want to go back to the horse's mouth and just kind of check up through some of this stuff in there, it's available to you through the link right there. Underneath the standards, you have obviously the measures, and this is where the documentation starts coming in. So now we have a measure that says the document required is one community health assessment data within 5 years. This is document management right here. You'll see pretty much every screen has this little blue folder. This one says there's 3 documents attached. I'll click on it. You'll notice there's only one, but it is version 3. So I say, show me the other versions by clicking here. We have version 1, 2, and 3. And again, we're going to go through this in detail in the next training here. But to add a document, just hit the plus button. You get a little dialogue. It says, pick a document off of your hard drive, your network, or wherever. You're going to upload it into our server. It'll show up down here with the file name. You're going to be able to describe the document in detail, any notes about the document in there. The expiration date of the document will go down here. And then you're going to use the traffic lights. Here's what most people use it for in accreditation. Yellow is a draft. You can have, by the way, as many drafts as you want in here, as many documents as you want. We don't limit any of that stuff. So you're going to have the draft document. The green would typically indicate that we as the department have completed the document and are ready to submit it. And then the gold would indicate we've submitted it up into the EFAB system here. So it helps you to track the documents through the life cycle. So you're going to attach the documents to the measures. That's kind of where they belong in there. and then you're going to be able to track them through their life cycle in here. Now, underneath the measure then are, I'm a kind of an outsider. I don't really know what's supposed to be in a community health assessment. Go down to the activity level. Here's the 7 requirements that FAB has for a community health assessment. Our first one says you got to have a list of the participating partners. Well, once you get the list, here it is right here. You're going to attach it. You're going to show all your versions again of the list. It says we've already submitted up into the EFAB system. We're all set to go here. So you can track all of these documents. Now, once you get all of these 7 activities completed and the documentation correct, you should have everything you need to go back and create your community health assessment. Now, what we do to get people started, and you guys will help us with this, and that is you're going to tell us who are your domain leads. So typically you're going to have, maybe some are the same people, some are different people, but tell us who the domain leads are. We take and push that all the way down to the objective and the activity level. So that person is now responsible for all of the objectives and activities. Now, that person can also go in and reassign. So if it's an objective that belongs to one of their staff members, they can reassign it, or an activity or whatever. You can add the external partners in there, lots of stuff. The other thing we would do is at the activity level, we're going to assign the dates for you. So pick a beginning date, it could be in the past, it could be now, whatever you want. The other thing you can do is say, we're planning on submitting documents by December 1st of 2024. So we're going to put that in as your end date, or maybe give you a 30-day window, whatever you want to do in there. So by doing that, the people and the dates, we turn on real-time planning. The system automatically notifies people as things are needed to be able to be updated, like supplying the correct documentation in the right place in the right time, that sort of thing. So this plan walks you through the accreditation process from beginning to end and allows you to track it. You can actually build what we'll call a VMSG public page, which is a graphical page that shows you the exact status of your accreditation. There's a whole report that goes here that has infinite detail of every document that's attached, the status of every plan element, all the way through the process here. So it's really pretty darn cool to have in the system. And again, you can have as many of these you want. If you want the older version to compare, fine. If you want the reaccreditation plan to go along with it, fine. You can have all you want. We don't charge for any of that stuff. Now, one of the other things that happened over COVID, we had a lot of our health departments who were actually continuing to go through accreditation. One of the problems they had was a lot of people like to do what they call a mock site visit, meaning maybe a month before you get ready to get all your documentation submitted and get your final site visit in here, you hire somebody who's kind of a FAB expert to come in and review everything that you've done. That was a problem when people weren't traveling and health departments were working from home and all that kind of stuff. So we built a tool in called a virtual mock site visit. So once you get all the documents and everything in that plan that we just showed you here, then we'll set up a virtual mock site visit. So you're going to pick the person. We're going to train them on how to do it. They're going to come in remotely and grade everything that you've done. They can use the traffic lights. You guys kind of decide how you want it to be marked and everything. When they're done, there's a report that gets generated that shows you all of your stuff, plus all of their comments and grades and everything else. And it'll give you the idea that, yep, we're ready to go, or oops, we got a couple of things to fix before we go. So, and by the way, it'll save you a ton of money, even if nowadays somebody could come into the department, why pay for airfare and hotels and all that kind of stuff? They can do it remotely just as effectively here. So what we just went through is the core functionality. And this is really what I want everybody to understand today is this is what the system's all about. Again, in the future trainings, we're going to go into a lot more detail. But just kind of an FYI, we got about 240 health departments using the system across the nation. Most of them are going through accreditation or reaccreditation. So for those folks who start out typically entering the FAB 6-pack of plans into the system, and we're here to help you to do that, you're going to get the plans into the system. You're going to use one of the accreditation plans, in this case, the accreditation 2022 plan for you guys. You're going to turn on the real-time planning. That gives you that automatic 9.1.6 because you're, in fact, engaging people at all levels in the organization to keep the stuff up to date. Everybody who's done exactly that has gotten fully demonstrated by FAB for performance management. So it really is a very, very well-known process. The FAB people, the reviewers all know us because, they've seen it 240 times, I guess, throughout their life cycle there. So all of that stuff is available to you now. Now, What I'm going to do next is I'm going to show you kind of a quick screen of additional features that we'll be covering in the future here, new toys and tools that are available in the dashboard. And then we're going to walk through the real-time planning process so you understand what that's all about. And I'm going to take you through the login process. We're going to go through it in a set of steps, and then I'm actually going to go through and log in for you, get your user ID, log in, and then we're going to go into what we call quick update, which is the simple way to update everything in the system. So we'll be about another 15 minutes going through all this stuff here. First of all, here's some additional features. I showed you document management. About 6 months ago, we kind of elevated that to intelligent document management. What was happening is we had a lot of health departments who were having trouble managing policies and SOPs and MOUs. They all have to be updated on a regular basis. Typically, it's a fiscal year. They have a team of people associated with doing the updates, but nothing to link them together. It says, Fred, you need to update this policy by this date. So we built that into the system. There's an activity, that QA activity you saw. There's an option for that called a timeline. What you do is say, we're going to set the beginning date to the beginning of the fiscal year. We're going to set it to an annual cycle. We're going to say when this light turns yellow, let's say 80% of the way through the year, Fred is going to get notified to go in. He's going to download that document, do the updates, upload the new version. All the lights turn green again, and it gets all managed through. So it really is, by the way, the most popular tool that we put in there since we've added it. People just love having all that available to them here. Bunches and bunches of reports in the performance monitoring training. We'll go through all the reports. VMSG Public, as I mentioned, is an interactive way to simply create public-facing web pages around anything in the system. So how's your strategic plan performing? How's your accreditation plan performing? All of that you can do very easily. Three-dimensional planning. This is kind of the last training that we do. And what this is all about interconnecting things in the system. We talked about the bottom of the dashboard where the performance or the strategic plan elements were displayed down there, and they were mapped against everything in the system. That's how it's done, is three-dimensional planning. You're going to tag everything that is related to public health essential number 1 in the system, so you can go tag against that. Again, we're going to go into three-dimensional planning in the last training. Real-time planning, we're going to talk about here in more detail, and I just showed you the FAB accreditation plans. So let's talk about real-time planning. Here's how it works. You guys determine the cycle. Most people do it monthly, but you can do it anywhere between daily and monthly. I don't suggest daily, people will shoot you. But let's say we set it for a monthly cycle. And we decide it's the first Monday of the month. So the first Monday of the month at 1 a.m., a system goes in and looks at everybody who's designated as an objective lead or an activity lead. And what it does is ask 3 questions. Number 1, has this person been in the last 30 days and updated their stuff? Number 2, does this person have anything that has fallen behind schedule? And number 3, does this person have anything that's overdue? Today's past the ending date. If none of those are true, no spam. If any of them are true, emails go out. Emails can go out to internal folks as well as external partners. In that email is a link, and because you are a designated activity or objective lead, the link will give you an option when you go in to go to either the main menu, where we've been all day, or the quick update screens. Now, there's 2 quick update screens, activities and objectives. I'm going to walk you live through them here in a minute here. But realistically, if you spread this around to the people who are actually doing the activities, the average across 240 departments is 3 to 5 minutes per person per month. So what you want to do is get it to the people who are actually doing the activities, because they know the answer right off the tip of their tongue. They don't have to go digging anywhere for it. They can answer the question in the quick update. They can be done in 3 to 5 minutes, and the system is completely up to date here. The activities quick update screen looks like this. Now, it looks a little complex because of the top of the pyramid here, but it's just context. Down at the bottom, there's actually only 3 fields you update. My traffic light, my data value, my notes field, hit the next button, go through. In this case, it says I have 29 activities I'm going to be updating. When I'm done with those, if I'm an objective lead, it's going to take me there, and I'm going to be done. Again, 3 to 5 minutes later. Now, the email that you're going to get from the real-time planning will look like this. Here's those 3 criteria I mentioned. Here's why I got the email. 1 or more of them is true. This is kind of an FYI. For everything you've been assigned at the activity level, here's your traffic lights. This is kind of if you need help, here's the people to contact. And these will be your designated administrators in the system here. So your people's names, their email, and their phone number will be there. If you have any questions, you can always call me. But this is kind of your first point, is to call your folks who are the kind of the experts in the system here. And then here's the link, login.vmsgdashboard.com. When I click on that link, it's going to take me to the login link now. What I'm going to do first is kind of walk you through the steps, and then I'm going to go live in and actually take you through the process here. So the steps are here. Number one, there's the link. And by the way, you can also just use vmsgdashboard.com. It'll take you to the VMSG dashboard homepage. Up in the top right corner, there's a link that says click here to log in. There's going to be a little dialog box. There's 3 buttons. The third button is send, which means send me my login credentials. You're going to get another dialog box that says enter your email address and click send again. Once you enter your email address and click send, you should receive a dialog that says success. If you get anything else, errors or whatever, contact us. We'll take care of it for you. What that means is it sent you your login credentials, and it did it pretty much immediately. So check your email. It should be there. If it's not there in a minute or two, check your spam folder. Now there's a login button in the middle of the screen. After you get this, you're going to go back to that. It's going to open up that same dialog. This time you're going to enter your user ID and email address. Either one works as your user ID. So you don't have to remember a new user ID. If you just want to use your email address, that's fine. You're going to enter your password and you're going to hit login. So that's the login process. So now I'm going to go through and take you back live into the system. I'm going to go up here to the top right. So these are your quick select buttons. This is your dashboard that you saw. This is the main menu. This is the reports menu. This is help and information. We'll go over that here in a minute. And this is log out. So I'm going to go ahead and hit the power button or the log out button, log off. Now this is the VMSG dashboard homepage. And there's the link I was talking about. Already a VMSG dashboard user, log in here. Click on that. Pardon me. It's going to take me to my login screen. So the first thing I'm going to do is use the send button down here. It's going to open up this dialog. I'm going to put in my email address. I'll just let it remember it for me here and hit send again. Now, hopefully I get the success dialog. I did. It means found your stuff, emailed it to you. Go to your email, grab it. You'll be all set to go here. Now, the email is going to look like this. So it's going to have your user ID again. You don't need to remember that user ID because your email address works just as well for your user ID. And if you need to go back and forth, you can do that too. It doesn't change a thing. What I would suggest, the passwords are kind of cryptic. So what I would suggest is that you copy this password off of the email because sometimes it has characters that look like other ones. It just makes it easier so you don't have to worry about it. So copy the password in here. Now, this is that login button I was talking about. I'll click on that. It's going to open that same dialog. This time I'm going to put in either, again, my username or my email address. I'm going to copy in, or I'm going to paste that password into here, and I'm going to hit login. And again, because I'm a designated activity or objective lead, I get this dialog here. Do I want to go back to the main menu or quick update? Let's go to quick update. It's going to take me to the activities quick update screen first. It's going to allow me, I only have one activity it says to update here. So again, down here at the bottom, I've got the group, the service, the goal, the objective, activity 1 of 1, the performance metric for the activity. I can cycle through the traffic lights with my mouse. I can put in the data value. I can put a note in here. If I want to put a date and timestamp on the note, this button does that for me right here. I'll put a note at the very top with the date and timestamp in front of it. If there's a data source, it's going to show up down here with a little link so you can have access to that in here. Once I update this, I'm going to go ahead and click on my next button. It says, hey, you're also an objective lead. Let's go and look at your objectives. I'll go into there. It's going to show me a very similar screen, but this is my objective. Remember, it's above the activities in the pyramid here. So again, traffic light, data value, notes field, my data sources here. And you'll notice that the activities reporting up to that objective are underneath it here. So you'll notice the activities are 2 of them are gray and 1 of them is blue. The blue activity means that it has been assigned to me. meaning that I just went through it and that's the one I just happened to update in there. So I don't have to do it again. The gray ones have been assigned to somebody else. Now let's say that person is off on vacation and I want to do the update. I have access to go in and do it from here. It just gives you the hierarchy, if you will, in here now. So that's my objective quick update. If I finish it up, it's going to give me the option to log out. You got a couple of buttons up here. The first thing I typically want people to do when they log in is to change their password. That's what the key button is here for. So I'll go ahead and click on that. Gives me the option. And again, paste the password out of the email into here just so you get it right. Put in your new password, verify, hit update, just like every other website in the world, and you're set to go. You'll also notice that the document management button is here. So if I need to attach a document to this particular objective, I've got it up there. My log out button. This is my help button. So let's go talk about that for a minute. I'm going to go back to my main menu here. You'll also notice the password button is down here on the main menu. So either place you can go in and get exactly the same dialog box to update your password. Now, let's go back. Let's say I'm on my services screen. I have a question about anything on the screen. So what are these buttons for? Or how do I add one? Whatever. Everything is contained in the help screen right here, the blue eye. So notice it took me right to adding managing services. First thing it gives me is just a step-by-step process, how to add a service, how to remove a service, how to edit a service. Here's what all those buttons are down here. So it gives you the definition of, all the buttons down there. So that's one view here. The next thing you have is a training video on specifically adding and managing services. Typically it's about 5 minutes long, but it's actually a training video. This is the entire user guide on one hyperlinked PDF file. This is a document called Implementation Guidelines. It is things that we've collected over the years from different customers on what works great, what doesn't work so well. Here's some IT issues you might think about. Here's a couple of templates that you can use to create operational plans. There's actually a section on page 2 that walks you through the step-by-step process of entering an operational plan. We'll be getting into that a little bit when we go into the next training, but that's all available. I do highly recommend reading through this document if it's your first implementation of the system, because it really goes through how to get people engaged. Who are the people who typically get engaged first, and who are the people who don't like to be engaged. I'm retiring tomorrow and I don't want to be engaged, whatever it happens to be in there. In addition to the live training that we're doing, if you like to do e-learning, these 5 training modules are up here. There's about the one we're going through today is this one up here. You don't need to worry about that. If you go through the other ones, the other 3 down here, it's about 2.5 hours, 2 hours, 15 minutes. Basics, operational plan development's the next one we'll be doing, performance monitoring after that. And then the 3-dimensional planning is kind of built into these modules on here. The administrator level is for those folks who are designated as administrators on how to manage permissions and users and that kind of stuff. But again, if you like doing e-learning, these are video-based training modules. They're all in there. Fully acceptable to use those as well. We really like to do it live because that way we get questions and answers and that sort of thing. So that is the help and information screen, and it's available to you 24/7. The quick update screen that we talked about is also available on your phone. So that's the other kind of primary feature on there. So again, you click on the link. Here's my example. I'm driving into the office in the morning. It's the first Monday of the month. I stop at Starbucks to have a coffee. I sit down at a table with my coffee, pop open my phone. Here's the email from VMSG. I click on the link. I'm going to log in again with the same login credentials I had on my desktop here. I'm going to go to quick update, go through my activities, go through my objectives. 5 minutes later, I'm done for the month. So just a nice convenience feature. And again, we already talked about training, help, and information. And that was the drink out of a garden hose for the day. Questions? Again, we're going to go into much more detail as we get into the next training session, but I just want everybody to kind of have the overview of what's available in the system for today. So anything else you'd like to see?
I think I'm good for now. I'm sure questions definitely will come up as we use it.
And you got my contact information here.
Just play with it.
Seems like a very efficient system for sure, once you learn to use it.
Thank you. Yeah, I think after you get your hands on and we get through the operational planning, you'll start thinking of about 1 million different things that you can do in the system. And by the way, there's no limits. You can put any kind of plans you want. any documents you want. And anytime you need help on getting to that level, you just get hold of us and we'll help you to walk through the process.
Sounds good.
Okay, everybody. Well, thank you so much for your time today. I appreciate that you taking the drowning with the fire hose here, but it'll get better from here on forward.
Thanks,
Thank
Fred.
Thanks, everybody.
Thanks, Fred.
Thank you so
Thank you.
much.
Thank you, Fred.
Bye-bye.
Bye. Thanks.